New question, the member from London West.
Thank you, Speaker. My question is to the Acting Premier. More than a year ago, London Health Sciences Centre, CMHA Middlesex, and Middlesex London EMS came up with an innovative project to divert 3,000 mental health patients each year from the emergency room to the CMHA Crisis Centre. The project has stalled because provincial legislation only allows ambulance transfer of patients directly to a public hospital and not to a community-based crisis centre. LHSC, CMHA and EMS have been asking for months for the Minister of Health to approve the project as a pilot to allow it to go ahead. The minister told the media yesterday that the project is already underway, but in fact it is waiting on his desk for sign-off. Will the minister commit to signing off today so that the project can proceed immediately?
Thank you. Minister of Health, Long-Term Care.
Mr. Speaker, I did have the opportunity to speak to this, I believe it was yesterday, and the work that CMHA, Canadian Mental Health Association, is doing in London with the brand new crisis centre that we funded to the tune of $1.2 million. It's remarkably important because it provides crisis intervention for adults, youth and adults aged 16 and up in both London and Middlesex County. They have put forward a proposal that we're looking at, which would permit emergency medical services to transport patients in crisis directly to that crisis centre. The member herself has acknowledged that it would require, it is currently illegal to do that, it would require a legislative change to the Ambulance Act. It obviously would have implications province-wide, but it is something that we're looking at.
Thank you. Supplementary.
Speaker, the mental health crisis in my community keeps getting worse. On Monday this week, LHSC psychiatric ER was at 152% capacity, with 26 mental health patients waiting for beds. This ER diversion project could save about $2.5 million annually by reducing the need for ambulances to transfer patients to the ER first and then wait, sometimes for hours, before they can transfer patients to the crisis centre. After he signs off on the pilot, hopefully today, will the minister commit to reinvesting the $2.5 million in savings back into the community so that the crisis centre has enough nurses to care for the expected 3,000 patients and LHSC can start putting patients in beds instead of hallway stretchers?
Thank you. Minister.
Well, you know, Mr. Speaker, I wish it was that easy. First of all, if I was to approve the pilot that the member opposite is advocating for, and I have to say that the member from London North Centre has been a strong advocate for this, and we have had conversations about it. But I can no more sign off on a pilot, which is nowhere near my desk, by the way. I can't sign off on that because it would be breaking the law.
No. I'm asking for quiet. Carry on.
But this is a very important project, and it points to the success of Mr. Speaker, this is a very important project, and it points to the success of the crisis centre that this government, funded, those beds that are available, the supports that are available in the community. I'm taking this very, very seriously. There's a lot of support for this, including the member to the left of me. And, Mr. Speaker, the ministry is looking at this, but it does have bigger implications in terms of it is currently illegal. It would require legislative changes to the Ambulance Act.
New question. The member from Brampton Springdale.